Dr. Adam Rosen here, orthopedic surgeon, specializes in knee replacements. What I want to talk to you about is very specific for my patients, but will be very similar for you wherever you have surgery. We spend a lot of time talking about the surgery and what the surgery is and what happens after. But there's a lot of anxiety that day of surgery. I mean, it's not normal to go in and have surgery. And the more that you understand what's happening, there's been studies that have looked at this, the less anxiety people feel. So I always say, like, the day of surgery, there's a lot that goes on up to the surgery. So what you should expect is you're going to wake up. Probably you didn't sleep well because you kept waking up. You were nervous about that surgery. You've been told not to have anything to eat or drink. So don't have breakfast. Occasionally, depending on when your surgery is, the anesthesiologist may say you can have clear liquids, usually like Gatorade, Pedialyte, 4, 6, 8 hours before surgery. So you got to be very specific about what the time frame is. You can brush your teeth. We say don't eat or drink, and some people are even afraid to brush your teeth. So you can brush your teeth. If you've been told to take any medications, you can take that with a sip of water. So you don't have to try to swallow these pills dry. And those are all concerns people have. They're told don't eat or drink anything, and you can take your medicine. And they worry about how much liquid they can take in. So a little bit of water to swallow your pills is fine. And then get to the hospital safely. Once you check in, for our patients, they go through a whole pre-op process ahead of time at their 2 or 3 week pre-op appointment. So they've checked their insurance card and all of that's been done with the office up front. So you're going to check in to the surgery center area. Once you check in, they'll bring you back. They will change you out of your clothes and give you a set of wash. So you'll use the chlorhexidine washes to wash your body. And then you get to put on one of those lovely hospital gowns with the back open. And then the nurse in the pre-op area will go through a lot of stuff with you. They're going to get an IV access started. They'll have you put a little betadine ointment swab in both of your nose or nostrils that helps decrease the chance of an infection. Usually the labs and EKG have already been done ahead of time, but if any special labs needed to be done that morning, you may have some blood drawn to check that. And then they're going to go through a whole bunch of the consents that we've discussed in the office with you, but they're going to actually have you fill out those consents and sign them. You get your band as soon as you check in. They're going to be verifying everything off of that band and who you are. And then all of our patients will get a little cup with their pre-op cocktail. So those are the medications that you may have heard me talk about before, where pills for inflammation, pills for nausea, pills for pain. We want to get that in early so that by the time you have surgery and wake up, those medicines are in full effect. So that's a lot of busy stuff. At that point, then usually, not in any particular order, but I'll usually see you first. So the surgeon's going to come and see you. We're going to say, how are you doing? How did you sleep? Make sure that you didn't eat or drink anything. Make sure that you're as comfortable as you can be, because again, it's an anxiety-producing event. And then we're going to go through everything. For me, and when I teach, residents and fellows, for me, I go through everything in a very specific order. It's just like your airline pilot that may have 50,000 hours. They still go through their pre-flight checklist. So I am going to, after I see you, check and make sure the consent is in the chart. It's the correct surgery, the correct body part, that your name is correct, that it's signed, it's been dated. We'll check that you have a blood consent signed, and that's on the chart. We'll check that you didn't eat or drink anything after midnight, that you've taken your medications, you've had your pre-op cocktails. I've already checked your labs the day before, but if any labs were due that day, we may recheck those. And then we're going to look at your skin. Make sure that the skin is okay, that there's no new cuts, scrapes, rashes that have developed. And as long as everything looks good, we're going to verify with you the consent is correct, the surgical site is correct, and then we'll sign the correct side, whether or not we're working on the right knee or the left knee. At that point, see if you have any other questions that may have come up since I saw you last in the office about the surgery. I let all of my patients know what's going to happen next. So that's a lot of what I'm going to tell you now. But I let patients know that once I've done all of that, that you're then going to see one of the nurses that works with us in the operating room. They're going to come out and talk to you. They're going to verify, again, who you are. What's your date of birth? What surgery are you having? And they'll do a handoff with the nurse in the pre-op holding area to make sure that all of this stuff's in the chart, the consent, the EKG, the labs, and all of that's appropriate. The next person that you're going to meet is the anesthesiologist. So the anesthesiologist will come, and they've reviewed your entire chart, but they'll go over your history and do a physical exam, mostly looking at your airway, checking your neck. They'll talk to you about the anesthesia and all the risks that may come with that and what to expect. And then for our knee replacement patients, we'll do what's called a nerve block. So they will use an ultrasound machine, and they will visualize the nerve in your leg, and they will put some numbing medicine around that area. Now, they don't put you to sleep for that, but they will sedate you, and a lot of people don't remember that. They have a bit of amnesia from the event. Once the nerve block's in and the room's all set up, so all of this is happening real time, the nurse will usually come out and then take you on your stretcher from that pre-op holding area back into our operating room. At that point, we will all see you again, and once again, you're going to let everybody in the room know your name, your date of birth, any allergies that you have, and what surgery you're having done. And it's an additional check, an additional sort of set of checking every single step along the way that everything's correct. We'll then have you move from the stretcher onto the operating room table. And then once everything's situated, that's when anesthesia will put you under anesthesia. And then we wash and prep your leg and do the procedure. Once the surgery is done, we will move you back onto the stretcher because you're usually still pretty groggy at this point. And you'll wake up, you'll be in the recovery room. In the recovery room, for most people, it's about an hour to an hour and a half. I'll see you there. A lot of people don't remember talking to me after surgery because they're still a little bit groggy. I've done the orders and done all my paperwork, called your friend or family member and talked to them. In this day of COVID, I don't get the luxury of going out and seeing them in the waiting area because everybody's at home. So I'm calling to let them know how you are. Usually about an hour to an hour and a half, we'll get you upstairs. And then the goal is surgery or therapy that day, the day of surgery. So therapy will see you. They will come and get you moving your knee, making sure that you can bend and straighten, and then make sure that you can stand. And as long as you're comfortable, have you walk. Some people walk 1 step, get a little nauseous. Some people walk 5 or 10 steps, get a little weak. Some people will walk all the way around the ward. So each person will progress differently. I let everybody again know the following morning I'll see you again. We'll change your dressings. We'll do therapy again, up and down the hallway, up and down the stairs. And once all of that's taken care of and you're doing well, we'll get you home at that point. And I like to go over all this again in the pre-op area because it's just reiterating to people what we've told you in the office and what you've read in the packet. But if you hear it over and over again, it will just decrease your stress and decrease your anxiety so that this day of surgery, which is a very big deal, will be less anxiety producing for you because you're going to know what's coming. So I hope that helps, and I'll see you next time. Thanks for listening.